Good evening and welcome to the American Academy of Nursing's 2022 Induction Ceremony. Thank you. Thank you. I'm Ken White, and it is my honor to serve as your Academy President. With me tonight is the Academy's President-elect, Dr. Linda Scott. Our co-host for this marvelous and meaningful celebration. The people who join us as fellows tonight, all of you, have done and will do inspiring work to advance health and achieve health equity around the globe. Martin Luther King Jr. said, of all the forms of inequality, injustice in health is the most shocking and inhumane. As we begin, let us thank our generous sponsors for this evening's event. For over a decade, the United Health Group has supported the Academy's induction ceremony. Thank you. Induction into the Academy is a pinnacle moment in a nurse's career. We are deeply grateful to the United Health Group for making possible the celebration that honors the contributions of nurses everywhere. I also thank everyone in the audience for joining us and supporting the success of our new fellows. 2022 marks not only the largest class of inducted fellows, but the largest attendance in the organization's history. Yes. In this room are partners, spouses, children, other family members, friends, colleagues, and mentors. Welcome, everyone. Thank you for being here. When we celebrate each of these new fellows, we are celebrating you. You have been the wind beneath their wings, as Bette Midler sang. Thank you for helping to raise up our fellows so that they can make the changes we all hope to see in this world. To each of our new fellows, congratulations and thank you. Together we will move the Academy forward, making it bolder, more inclusive, and ready for the challenges ahead. I like to say that we are nurses out loud, using our collective voice to seize the opportunity for change, regain trust where it has been lost, serve as ambassadors for global health diplomacy, and always and everywhere to act to challenge and reduce health inequity. Now, new fellows, I met you all yesterday morning. Please stop and look around the room. Look at how many came to celebrate you. Look at the fellow sitting to the right. Now look at the fellow to your left. Tonight, be sure to hear their achievements. Think about the connections you could make to furthering your work and amplifying our collective impact. When I was inducted 10 years ago by Joanne Dish and Diana Mason, I was inspired by hearing about another fellow in my cohort who was working in the palliative care space. I was from Virginia and I was on the back row, and I didn't hear, I was so nervous about walking across the stage. But the one that stood out was the person who worked with people who were at the end of life, who were incarcerated. That takes a very special person. Her story has stayed with me for years. Fast forward to the Council for the Advancement of Nursing Sciences 2022 State of the Science Congress on Nursing Research about a month ago, when I had dinner with the National Advisory Council. I asked people when they were inducted, and we shared our years, and as I shared my story, about the woman who inspired me the most the night that I was inducted. The woman sitting next to me, to my right, Dr. Susan Loeb, leaned over and said, "That was me." I was moved. Our fellowship is more interconnected than we fully understand. Life presents us with the most perfect, serendipitous moments. Let us cherish them. As your president, I have had 4 pillars guiding my work: strength, culture, colleagues, and community. This evening, all of these pillars are on display. We show our strength and our convictions. We build a culture of inclusivity. We celebrate our colleagues' accomplishments, and we grow as a community of nurses whose mission is driven by our passion for better health. Welcome, new fellows. Walk with us. Show us your strength. Amaze and inspire us.
Tonight, we commemorate the achievements of 231 amazing nurse leaders who will be joining the Academy as fellows. Our newest fellows represent 35 states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, and 16 countries. Yes. Nursing is a profession that places compassion and science at the center of our work to actively improve health outcomes worldwide. This year, you will hear from fellows in their own words how their accomplishments ushered in change at the micro, macro, and meso levels. We will also pay tribute to the visionary leaders who will become honorary fellows of our organization.
Yesterday, we had the opportunity to recognize this year's 2022 Living Legends. We celebrated their spectacular contributions and global nursing leadership. Dr. Jane Barnsteiner, Dr. William Holzheimer, Dr. Jeanette Ives Erickson, Dr. Norma Martinez Rogers, Dr. Joyce Newman Geiger, and Dr. Franklin Schaefer. To all of our living legends, those who are in this room today, those we recognized last night, and those who have died, thank you for your leadership and your stewardship of the profession and helping to leave a lasting legacy. Before we begin, I would like to personally thank the courageous leaders whose vision and dedication helped build the American Academy of Nursing. Linda.
Supporting an organization by providing one's time, talent, and treasure elevates its impact. We are grateful to the many volunteer leaders who advance the Academy's mission by serving on the board of directors, committees, and expert panels.
I'm proud to be the president of this organization at this critical time in history, from the charter members of the Academy to the inaugural cohort of fellows in 1973 to our past presidents. I am grateful that their vision, influence, and commitment was a catalyst to transform policy and usher in meaningful change while growing the impact of the Academy. Before we launch into the festivities, I have the privilege to honor this year's recipient of the Academy's Lifetime Legacy Award. Created in 2019, this award recognizes an extraordinary individual who has dedicated their life to advocating for positive health system change. I am pleased to bestow I know, right? Yes. I am pleased to bestow this award. I say we have some fans here. This award so deservingly goes to Dr. Linda Burns Bolton, Chief Nursing Emerita of Cedars-Sinai in Los Angeles. Unfortunately, Dr. Burns Bolton is unable to join us this evening, but I know many of us are familiar with Linda and can attest to the tremendous strides she has made throughout her career. A formidable leader and expert in health system management and health equity, Dr. Burns Bolton has impacted policy, clinical practice, and patient care nationally while elevating the role of nurses always. She joined Cedars-Sinai in 1971, later to become the inaugural holder of the James R. Kleinenberg and Lynn Kleinenberg Lincoln Chair in Nursing. Throughout her 50-year tenure, Dr. Burns Bolton has held numerous leadership positions, including Senior Vice President and Chief Health Equity Officer at Cedars-Sinai, as well as presidencies at organizations including the National Black Nurses Association, the American Organization of Nurse Executives, now the American Organization of Nurse Leaders, and of course, the American Academy of Nursing. Dr. Burns Bolton believes deeply in servant leadership and has given her time to many efforts that support individuals, families, and communities, particularly in her mission to eliminate disparities. Dr. Burns Bolton's New Beginnings project in Los Angeles grew out of her passion for parent-child nursing and the need to decrease the infant mortality rate for African Americans living in Los Angeles. She co-developed the community collaboration model to link physicians and nurses in professional societies with neighborhood businesses and organizations. She was the vice chair of the Robert Wood Johnson Foundation's initiative on the future of nursing at the Institute of Medicine, now the National Academy of Medicine. The resulting report was a landmark study on how to improve the healthcare system, elevate nurses' access to leadership positions, and support their continued educational advancement. She also served as a member of the Board of Trustees of the Robert Wood Johnson Foundation. Dr. Burns Bolton is also one of the most sought-after policy experts. Name a federal agency, and she's likely served on its advisory council or commission offering her expertise in system management, the nursing workforce, and quality excellence. From the Agency for Healthcare Research and Quality to the National Institute of Health to the Veterans Health Administration, Dr. Burns Bolton's voice has been advocating for improvements at the highest levels of government spanning decades. Dr. Burns Bolton is a true servant leader. She believes in human caring and mentoring others to join her in collective ownership of the challenges we face in our healthcare systems and communities. She often speaks of courageous circle calling. She told me about that and I bought the book. So now I'm a fan. Calling the circle. The idea that we can be a leader and a follower, or that we may ask for help and remember the importance of paying it forward. Dr. Burns Bolton is a visionary, a living legend of our organization, and tonight, honored for her lifetime legacy. Here to accept the award on Linda's behalf is her longtime colleague and friend, Dr. Bernice Coleman, Director of Nursing Research and Assistant Professor for Biomedical Sciences and Medicine at Cedars-Sinai. Bernie, please come to the podium.
Good evening, Academy leadership, board members, fellows, and guests. It's my honor to read the words. Oops, thank you. It's It's my honor to read the words of Dr. Linda Burns Bolton, who's unable to attend tonight to accept this lifetime award. Dr. Bolton is affectionately known as LBB. She's a consummate leader, visionary, clinician, friend to many, whose life has exemplified being of use to mankind as she lifts up human caring. Her work at Cedars-Sinai is foundational to our integration of the caring science model. I'll read her words of acceptance. It is my honor to accept this award on behalf of all nurses who have participated in the human caring experience. We are dedicated to helping others to be successful in life. To that end, we will give of ourselves and loved ones to be of use to others who are less fortunate than us. I am truly grateful to my mother and my family members who have worked with me over the years to be of use to others. Thank you very much to the members of the Academy, the National Black Nurses Association, the National Black Nurses Foundation, the Association of Nurse Leaders, who have joined with me on this journey to be of use to mankind. May God continue to hold you in his hands and to lift you up as members of the greatest profession in the world, nursing. Please keep on giving and being of use to the thousands of humans looking to us to be of use to them. We are the greatest profession, and I feel honored to be recognized by the Academy for my contributions to mankind. Thank you, and may God continue to hold you close to him and his people from around the world. Thank you.
And now, it's time to begin our induction ceremony. I love this. Let's make some noise. This night would not have been possible without the time, energy, and passion of our Academy's Fellow Selection Committee. This year, the committee was led by Chair Dr. Debbie Chapman-Bryant and co-chair Dr. Terry Murray. Both Linda and I are former members of the Fellow Selection Committee, and we know the very difficult task the committee members have in reviewing the many stellar applications. This year, the committee reviewed 431 applications, surpassing the record which was broken last year by 97 additional applications. Tonight, as Linda mentioned, 231 new fellows will be inducted. Linda.
I want to take a moment to also recognize the new fellow sponsors. Sponsoring a candidate, yes. You should know that sponsoring a candidate for induction is an important role for the organization. Sponsorship signifies their commitment to identifying talent, supporting nursing leadership, and paying forward the gift we all received from our own sponsors during this process.
As Linda mentioned, tonight we will hear from the fellows themselves. To learn more about the new fellows, their amazing accomplishments are captured in depth on the conference website for you to review after or during tonight's event. Without further ado, on with the celebration of nursing excellence. Linda.
Our first fellows to be inducted tonight join us from the state of Alabama. Azita Amiri.
My work has two domains. The first domain is dedicated to health and well-being of disadvantaged and environmental justice communities through advocacy, community engagement, and policy changes. And the second domain is focused on nurses' occupational health.
Azita, welcome to the Academy. Martha Dawson.
I believe that a child educated is a family elevated. My career impact has centered around increasing diversity and growing the next generation of nurse leaders. By providing over $1.2 million in scholarships in the last 3 years and addressing health inequity, identifying over $30 million to support community-based organizations.
Martha, welcome to the Academy. And now, Sharon Holly.
The most significant contributions to health I have made are in the areas of reducing maternal deaths, reducing medical errors related to fatigue, reducing primary cesarean sections, and implementing new models for interprofessional care in maternal health.
Sharon, welcome to the Academy. Candace Knight.
As a policy leader, I implemented and elevated the Nurse-Family Partnership model of care, developing one of the first NFP agencies within a school of nursing and bridging health equity for over 500 at-risk families. My advocacy for vulnerable families elevated nurse home visiting for pregnant and parenting women to a statewide policy priority.
Congratulations, Susan. Welcome to the Academy. Yao Chai Ng.
I've dedicated my career to ensuring
that was my
certified
fault.
registered nurse
Susan
anesthetists
McMullen.
may practice across the nation to improve individual and population health equity, increasing the numbers of CRNAs during a critical anesthesia workforce shortage, promoting high-quality education, and creation of policy to ensure lifelong learning are examples of these efforts.
Congratulations, Susan. Welcome to the Academy. So I got ahead of myself, so now Yao Chai Ng.
My most significant contribution to the healthcare field has been the initiation of pre-exposure prophylactic, or commonly known as PrEP, in HIV prevention services.
Congratulations. Michelle Tolley.
I have dedicated my nursing career to creating and developing nurse-led, team-based, patient-centered models of care. My hope is to continue my work within academic practice partnerships focused on transforming a healthcare workforce equipped to care for the most complex and vulnerable populations.
Congratulations. Welcome to the Academy. Brian Wilbanks.
Through my research and leadership, I have improved the quality and safety of nurse anesthesia-related patient care nationally through the assessment of usability of perioperative information technology and through health science research to identify the contributing factors to adverse events. This work has resulted in recommendations for information system design and clinical guidelines impacting the safety of nurse anesthesia practice.
Congratulations, Brian. Welcome to the Academy. And now from the state of Arizona, Timian Godfrey.
My most distinguished impact has emanated from dedicated policy and service efforts for creating sustainable, healthy work and learning environments that are inclusive and illustrative of diversity. My leadership has resulted in crucial, scalable advances for education and clinical practice to advance the practice and science of equity, diversity, and inclusion.
Congratulations, Timian. And now from the country of Australia, May Krishnaswamy.
My work has addressed equity of access to supportive care for vulnerable Australians affected by cancer, enabling almost 16,000 Australians to freely access evidence-based supportive care resources to enhance their capacity to self-manage and to reduce burden of care on health services.
Welcome to the Academy. And now from the state of California, Kenneth David Bailey.
My impact on health starts from the leadership perspective. Leaders do make a difference. When leaders create the environment for nurses to practice at their highest level through mentorship and open dialogue, they set the stage for patients to have the best care possible.
Welcome to the Academy. And now, Dawn Bounds.
I advocate for adversity-impacted youth marginalized by society. As a nurse scientist and psychiatric mental health nurse practitioner, I have worked to transform health and healthcare by amplifying youth voices and designing, testing, and implementing trauma-responsive interventions in settings like juvenile detention, homeless shelters, drop-in centers, school-based health, and the internet.
Congratulations, Dawn. Welcome to the Academy. Richard Fiedler.
My contributions to health and healthcare are through the combination of clinical practice, clinical simulation, teaching, and using clinical simulation as a research platform to improve quality and safety in healthcare.
Congratulations, Richard. Welcome to the Academy. Elena Flowers.
As a nurse, I impact health through research, policy, and education. My program of research, focused on a precision health approach to diabetes prevention, is aligned with my role as a member of the board of the California Institute for Regenerative Medicine and my prior development of educational tools for nurses in this new era of genomic health.
Congratulations, Elena. Welcome to the Academy. Elizabeth Gatewood.
My greatest contributions to health have been focused on increasing access of care for underserved patients, particularly those with mental health and opioid use disorder. And my other contribution has really focused on diversifying our profession through creating an inclusive environment in the clinical setting and the didactic learning environments.
Congratulations, Elizabeth. Welcome to the Academy. Karen Grimley.
My contribution impacts health through the design and implementation of workforce strategies created in partnership with frontline nurses. The dissemination of these workforce strategies now informs other healthcare leaders and serves as an exemplar for health systems across the United States.
Congratulations, Karen. Welcome to the Academy. Yuping Go.
The most significant contribution to health I have made is the reduction of maternal and child health disparities through collaborating with community organizations, embracing cultural elements, integrating my body approach, and leveraging technology.
Congratulations. Welcome to the Academy. Orlando Harris.
Through my research and teaching, I consistently advocate for equitable access to healthcare services for sexual and gender minorities and people of color in the United States and those in the African diaspora. I have established a program of research at the intersection of health disparities, equity, and justice to better understand and dismantle systems that contribute to medical racism and mistrust.
Congratulations, Orlando. Welcome to the Academy. Lori Judson.
As Executive Director for the Chin Family Institute for Nursing, I strive to deliver nursing excellence to vulnerable urban populations by resolving issues that intersect education and practice. From triaging wounded warriors during the Iraqi-Afghanistan conflict to increasing the number of culturally diverse BSNs in California, the result has been healthier lives for all.
Congratulations, Lori. Welcome to the Academy. Mary Rezick Hanna.
The most significant contribution to health I have made is using physiologic objective data documenting the cardiovascular impact of tobacco products and using these data to drive evidence-based policy to regulate novel and alternative tobacco products and nicotine delivery systems.
Congratulations, Mary. Welcome to the Academy. Marianne Schultz.
Precision health is revolutionizing nursing practice and empowering our patients to live healthier, fuller lives. The development of actual nursing competencies for precision health practice is now under the aegis of the American Nurses Association. and our work group is now preparing nursing workforce capacity for digital or connected care. Imagine that, the chance to make policy come to life.
Congratulations, Mary Ann. Dan Weberg.
Health is about adaptability and evolution. My work has helped organizations, teams, and individuals transform to meet the changing healthcare landscape. Through Positive Deviance, I've influenced the creation of new organizations, care models, and education systems, all to support interprofessional teams, respect our traditions, and challenge the status quo, using innovation to drive to the future of health.
Congratulations, Dan. Welcome to the Academy. Josh Weimer.
Through my work, I look forward to continued advocacy for nurse-led innovation, for human-centered design, and for nurses to be seen as vested peer collaborators critical to the success of interprofessional teams.
Congratulations, Josh. Welcome to the Academy. From the country of Canada, Angela Cooper Braithwaite.
My significant contribution to health is healthy public policy. For example, I've influenced the provincial government of Ontario to amend the Highway Traffic Act to include distracted driving and passenger safety.
Congratulations, Angela. Monica Perry.
The most significant contribution I've made to health and health equity is through my program of research focused on women's global heart health and through my educational leadership in nurse practitioner education, which has included support for changes in NP scope of practice.
Congratulations, Monica. Welcome to the Academy. Sherry Price.
My program of research seeks to understand how we best recruit, retain, and socialize nurses and other health professionals within the healthcare system. Our findings have been used to inform interprofessional education curricula and to enhance the quality of workplace environments and relationships.
Congratulations, Sherry. And now from the country of China, Lu Chen.
I try my best to promote the management of chronic disease, the innovation of nursing technology, and the equality of healthcare resources. I will continue to focus on the healthcare.
Congratulations. Welcome to the Academy. June Lei.
I will focus on the nurse-led MDT of healthcare and the integration of information technology in nursing in China so as to promote the research, education, and practice of nursing for women and the elderly.
Congratulations. Welcome to the Academy. Lu Li.
I devoted my main energy to innovating specialized nursing training programs, setting national standards of nursing care, improving care quality, expanding nursing practice scope, and funding collaborations domestically and internationally.
Congratulations. Welcome to the Academy. Qiai Zhang.
I'd like to cooperate with others to explore more reliable, effective, and low-cost cognitive assessment strategies of dementia prevention and caring for the elderly with dementia so as to improve health aging.
Congratulations. Welcome to the Academy. Jun Zhang.
My contribution is to improve the quality of cancer care, especially in remote areas in China, and my leadership role to promote nursing development, especially in the Guangdong, Hong Kong, Macau Greater Bay Area.
Congratulations. Welcome to the Academy. And now, from the state of Colorado, Heather Coates.
I
My contributions as a palliative care leader focus on the delivery of high quality, high value palliative care. And my work as a nurse scientist focuses on who the person is, not only what illness a person has. And my work as a teacher trains the next generation of palliative care clinicians.
Congratulations, Heather. Welcome to the Academy. Rosario Medina.
My primary contributions to the nursing profession focuses on providing leadership that improves the lives of marginalized communities by engaging in policy that target to diversify the nursing workforce and by purposefully designing educational programs that attract and mentor diverse students.
Congratulations, Rosario. Welcome to the Academy. From the state of Connecticut, Bernadette Zhao.
My focus as VA leader has been the expanded authority of the nursing profession. This advocacy and action, APR and Full Practice Authority has increased veteran access to care, supporting the next generation of VA nurses while driving better patient outcomes for America's heroes.
Congratulations, Bernadette. Welcome to the Academy. Sohan Nam.
The contribution to health I have made through my program of research is identifying solutions for health equity among underserved population by studying social determinants of health at the individual, interpersonal, and community level, such as improving sleep, physical activity, neighborhood environment, social network structure and functions, and cardiometabolic health disparities.
Congratulations. Welcome to the Academy. Gina Novick.
My contributions have been in the realm of disseminating and implementing innovative models of care to childbearing families, in particular freestanding birth centers and group prenatal care.
Congratulations, Gina. Welcome to the Academy. Cheryl Ann Reshaw.
By leading national level policies and practices regarding school nurse competencies and standards of care, I have impacted the health of our nation's youth. My work empowers school nurses to address the pressing issues of public health, population health, and health equity for all children and their communities.
Congratulations, Cheryl Ann. Welcome to the Academy. Joyce Shea.
My contribution has been the development and expansion of the full range of services in integrated behavioral health care. I've created innovative education models for advanced practice nurses, developed an online telehealth education toolkit, and co-chaired the latest edition of the Scope and Standards of Psych Mental Health Nursing Practice.
Congratulations, Joyce. Welcome to the Academy. And now from the state of Delaware, Maureen Shekel.
My sepsis work has established standards of care and measurable outcomes for this challenging population that are used worldwide today. Throughout my career as a clinical nurse specialist, I've championed, developed, and widely disseminated critical care evidence-based practices and research to optimize best patient outcomes.
Congratulations, Maureen. Welcome to the Academy.
Each year, the Academy's board receives nominations for honorary fellowship. These individuals who have a background outside of nursing have exemplified interprofessionalism throughout their professional careers. Their induction as honorary fellows signifies their outstanding contributions to healthcare and their collaboration with the nursing profession to improve care. The first honorary fellow to be recognized is Dr. Paul Farmer, in memoriam. Paul Farmer was the Colocotrones University professor and chair of the Department of Global Health and Social Medicine at Harvard Medical School, chief of the Division of Global Health Equity at Brigham and Women's Hospital in Boston, and co-founder and chief strategist of Partners in Health, or PIH. Dr. Farmer made a truly outsized impact in the field of public health. He was a champion for the most underserved populations globally, working tirelessly to address health disparities. As co-founder and chief strategist of PIH, a global public health organization with 19,000 employees, the largest group of clinicians being nurses and midwives, Dr. Farmer responded to and delivered health care to some of the world's poorest people. Working with local providers, Dr. Farmer and his team responded to a wide variety of the most pressing health crises and emergencies, including tuberculosis, HIV/AIDS, and Ebola, serving over 8 million people in 12 countries since it was established in 1987. Dr. Farmer was also vigorously involved in the response to the COVID-19 pandemic and urged the Biden administration to drop intellectual property barriers that prevent pharmaceutical companies from sharing their technology. Dedicated to the advancement and education of nurses worldwide, Dr. Farmer led the creation of the University of Global Health Equity in Rwanda, which houses the Center for Nursing and Midwifery, and the Hospital Universitaire de Mirabel in Haiti, which trains nurses for surgery, neonatal intensive care, oncology, emergency, and other specialties. He was a teacher, mentor, writer, colleague, and friend, but most importantly, he was a gifted and compassionate healthcare professional who believed all human beings deserve equal respect and care, particularly when sick. Until the very last day of his life, he worked to repair health inequities among and within countries of the world. Accepting on his behalf is one of his sponsors, Academy Fellow, Dr. Sheila Davis, Chief Executive Officer of Partners in Health. Sheila.
Thank you so much to the American Academy of Nursing for bestowing this honor of fellow to my dear friend, Dr. Paul Farmer. Thank you also to Pat Doust and Dr. Billy Rosa, who were the co-nominators. I vividly remember asking Paul his thoughts on being nominated last fall, about a year ago, as we left our office in Boston. I had thrown it haphazardly, as usual, into our many conversations about caring for the people in the 12 countries in which we work. And he stopped, grabbed my arm, and very sincerely said, "I would be so honored if I was chosen." I knew he would be proud to be honored by his ultimate teachers. He asked me another time around the holidays if I had heard back from the nurses yet. Although Paul had received hundreds of honors and awards over his four decades as one of the co-founders of Partners in Health, that you heard in his introduction, he genuinely hoped that he would be invited into this nursing community. Paul died very suddenly and unexpectedly in February of this year, at age 62, while in Rwanda, doing what he loved most, which was seeing patients and teaching nurses and doctors. He would have turned 63 this past Wednesday. As you have heard, Paul was an anthropologist, a physician, a scholar, and an activist, but probably the role that few of you know was he as nurse champion. When seeing patients around the world, including in Boston, he would seek out the nursing staff and always ask what was going on. At the end of the day, leaving the hospital, which was very hard for him to do, he would say to those around him, but I think more to himself, "It will be okay because the nurses are there taking care of things." Last December, Paul texted me a picture from Rwanda of a PIH nurse teaching medical students how to do an echocardiogram. He was so excited and said, "Nurses have always been my best teachers, and this is happening here." Paul was wonderfully supportive of me and my trajectory at PIH over the past 13 years and enthusiastically supported me to be CEO of Partners in Health. We are a social justice healthcare organization. We work in 12 countries, serve 8 million people for primary, secondary, and tertiary care, and influence over 34 million others in the policy arena of HIV, TB, and non-communicable diseases. Paul believed and infused into PIH that all people were deserving of high-quality health care, regardless of race, gender, geography, or socioeconomic status. We listen to the communities in which we serve, and their lived experience is the expertise we have to create the solutions. We work with governments because we strive to strengthen the public infrastructure and health systems rather than create siloed or parallel systems, because if health is to be actualized as a human right, it is the role of government to respect, protect, and fulfill that right. To do this, we rely on our community health workers as the backbone of our care delivery work. Our mission is founded on the principles of accompaniment, walking in pragmatic solidarity with our patients, families, and communities. Paul talked about expert mercy, which he termed as the marriage of expertise and compassion, choosing to enter the chaos of someone else's life and walk with them. Paul inspired a PIH model of care which does address all of the social economic rights of people, including food, housing, and education. And one of Paul's greatest joys was planting trees and flowers and gardens outside of all of our facilities around the world. He wanted to ensure that patients had a place to heal and staff had a place to rejuvenate. Many of us, after seeing patients for long days, would leave Paul on the side of the clinic digging in the dirt, the thing he loved to do the most. We could not see this brilliance in the making like he could until he envisioned and saw it, and the beauty erupted in unexpected places. Paul's unwavering belief in all people being equal and deserving high-quality health care was instrumental in the movement for global health equity, and he transformed the way that people thought about the moral imperative to care for one another. The loss of Paul is immeasurable, but he left behind an army of global health equity warriors who continue to fight every day for health as a human right. I miss my chief strategist, our North Star, my partner in maintaining this wonderful organization, and most importantly, my friend. And so, my dear Paul, you are now in this extraordinary academy, and you are one of us. You can take your well-deserved rest and tend to your garden in the sky. The nurses are here, and we will continue the fight for global health equity and for justice. Thank you.
Thank you, Sheila. From the District of Columbia, Carolyn Curtis.
My contributions include redefining the international model for post-abortion care and identifying its evidence, facilitating changes in core competencies for global midwife education, and policies that have been adopted and used for nurses, midwives, and OBGYNs in 124 countries.
Welcome to the Academy. Michelle Kane.
My diverse leadership roles has allowed me to synthesize policy development, lead the advancement of research and education, and develop systems-level, high-reliability processes within the Department of Defense in order to support a medically ready force.
Congratulations. Simi King.
Through my work, I've advanced innovative academic practice partnerships, facilitated strategies to support diversity in the nursing workforce, and equipped nurses with the competencies much needed to address the medical and social factors influencing the health and health outcomes of our clinicians and the communities we serve.
Sharon Lamberton.
I impact patient care very differently than when I was wearing scrubs.
Whether I'm testifying at a state capitol, working with legislators or governors, or presenting in the boardroom, I truly love what I do in public policy.
Linda McIntyre.
Thank you for serving and leading. I collaborated to make heart-mouth resilience training available for Red Cross employees and volunteers. The techniques can be used in the moment. When we support our personal well-being, we're better together. And together, we're working to achieve health equity for all.
Christine Pence.
As a clinician, educator, and researcher, my impact has been through my integration of innovation, technology, and person-centered care to patients and families in rural and urban underserved areas.
From the state of Florida, Beverly Bokovitz.
As a nursing leader, I have had a profound impact on patient care and community health outcomes. While leading large academic healthcare systems, I have proudly served on 7 community boards, and my participation has served to improve health outcomes for victims of domestic violence and to advance health equity and access to underserved populations.
Howard Butcher.
The unifying theme of my scholarship is the advancement of discipline-specific knowledge into education, research, and practice. I developed research and practice methods derived from the science of unitary human beings and unitary caring science theories. And I'm the author of the Nursing Interventions Classification System, which is used globally in research.
Sandra Cadena.
My most significant contribution in my 40-year journey of mental health nursing has been the implementation of a practice-focused, community-based project, expanding mental health accessibility to vulnerable populations, impacting policies of the Colombian Ministries of Health and Education, and elevating nursing onto the global stage.
Catherine Collins-Fulay.
I believe my greatest contribution has been to bringing various groups together for the common purpose of building high-quality, evidence-based models of care that promote a paradigm of equal and shared responsibility with our physician colleagues. When the norm is effective collaboration rather than competition, we all advance, which improves outcomes for the peoples we serve.
Laurie Duckworth.
My research generated new evidence that children with sickle cell disease who also have asthma are at an increased risk for acute chest syndrome, a leading cause of mortality in this group. Our integrated sickle cell and pulmonary care clinic model reduced unplanned urgent care visits by 89%.
Sophia George.
My contributions have led to the assessment and inclusion of spirituality and existential well-being in HIV care and better elucidated the role of housing and telemental health group counseling among people with HIV facing depression and substance use. My current research uses AI and machine learning to predict COVID-19 outcomes and help those with long COVID.
Lucinda Graven.
Throughout my career, I have contributed to national and international clinical practice guidelines for social determinants of health, led funded research of innovative telehealth home-based programs, authored multiple articles advocating for greater support for patients and their families, and presented on topics resulting in global research and discussion on coping with heart failure in patients and caregivers.
Ting Ting Lu.
My contributions include international nursing leadership as board of directors with International Society of Nurses in Genetics, national nursing leadership as president of Arkansas chapter of the Asian American Pacific Islander Nurses Association, and pioneering research using genomics to guide precision exercise interventions to improve cognition among people with type 2 diabetes.
Renee Love.
Responding to the call for improved nurse practitioner education, I have focused my contributions in nursing and health as a leader in the doctor of nursing practice education, improving the quality of DNP education at the local, the national, and the international level.
Geraldine Martorella.
My most significant contribution is a novel pain management intervention that improves health outcome and health equity. Through research, innovation, and leadership, I have been able to impact pain relief globally and to highlight the unique contribution of nursing to this mission.
Daleen Penoyer.
My contribution has impacted the health of critically ill patients through advanced practice, research, and developing care protocols with collaborative practice teams. Focus areas include prevention of iatrogenic infections, glycemic control, evidence-based practice, and innovations in nursing.
Carmen Rodriguez.
The focus of my research is advancing symptom science and improving health equity for suddenly speechless patients, head and neck cancer survivors, and among the Hispanic population. My goals are to advance the development and delivery of technology-enhanced communication interventions to improve health equity in communication at national and global forums and facilitate equitable delivery of interventions into practice.
Hudson Santos.
By using a combination of methods that spans from biology to implementation science, my research develops the strategies to reduce the effects of social adversity on maternal-child health outcomes and promotes positive child health development among at-risk populations.
Renee Thompson.
I aim to create a world where bullying and incivility are immediately rejected and respect, professionalism, and kindness become the new norm. As a fellow, I will continue equipping nurses with the skills and tools they need to eradicate bullying and incivility. The way we treat each other should be just as important as the care we provide.
And now from the state of Georgia, Desiree Clement.
As a certified nurse midwife, family nurse practitioner, and nurse educator, I feel my impact on healthcare has been mostly through clinical practice, educating future nurses, and advising on health policy, especially for removing barriers remaining here in Georgia on APR and scope of practice. My hope is to continue assisting nurses to find their inner advocate voice and to help with moving that needle forward here in Georgia to achieve full practice authority for expanding healthcare access for all Georgians.
John Cranmer.
My Emory Ethiopia team mobilizes mothers, communities, clinicians, governments, and scientists to create high-impact yet low-cost solutions for maternal and newborn deaths. Our Kangaroo Mother Care program provided novel global evidence, national policy change, and 87% survival for vulnerable newborns.
Stuart Downs.
My most significant contributions have been infusing deliberations of ethical behavior at every level of leadership and practice, and expanding meaningful recognition and sustainable cultures of caring across 5,400 global healthcare organizations. My efforts have leveraged evidence-based nurse executive competencies that have elevated and transformed global health.
Dwayne Hooks, Jr.
My administrative and clinical practice is aimed at increasing access to integrated physical and mental health care services for vulnerable individuals, particularly in rural settings, utilizing registered nurses at the highest levels of their education and license. These contributions to improve health have been made possible through a hub and spoke model, coordinated through a nurse-managed health center and a network of high-tech telehealth equipment.
Rose Horton.
My contribution is my unrelenting focus on equitable care for all birthing people, especially Black, Brown, and marginalized communities. My hashtag, Not on My Watch, is a call to action for all nurses. Let's commit to mitigating morbidity and mortality. Say it with me, not on my watch.
Michelle Monroe.
As a nurse and a certified nurse midwife, I have been an advocate for women throughout my career. Ultimately, my goal is to empower women with a choice. From nursing at the bedside to a hospital CEO, I have always been a patient advocate.
Bonnie Prue.
My contribution to advancing nursing and healthcare is evidenced by the development and national dissemination of a supporting framework for the advancement of nurse practitioner practice. The model's outcomes demonstrate increased revenue capture, quantify value, and improved retention and engagement. In addition, it showcases care models of APRNs improving access and outcomes for patients, resulting in high-quality healthcare.
And now from the state of Hawaii,
My
Nancy
greatest impact to health has
Atmosphere
been advancing
Walsh.
the nursing profession through philanthropy, like my support of the nursing profession at the University of Hawaii, and building a nurse-led business, providing care to the vulnerable population. These efforts have shown evidence of substantive and sustained impact to health, practice, and policy development.
Deborah Mathias.
Through my work, I've improved healthcare access and reduced health disparities for children across Hawaii. I created Hawaii's first school-based dental sealant program and transformed a nurse-led school-based health program that includes virtual care to increase access to our rural and underserved areas.
And now from the country of Hong Kong, Edmund Pugh Hong Choi.
My research focuses on the sexual health of men who have sex with men. My work has informed HIV and STI prevention, sexuality education, and health policy. My contribution have improved the health equity and access to care of men who have sex with men.
Simon Ching Lam.
Through my work, I developed compliant with center precaution scale with 12 languages, Chinese-specific N95 respirators, and established an accredited testing laboratory for face masks, which safeguard the health of people from infection.
Lorna Kwai Ping Swin.
My major research contribution is the successful generation of scientific evidence using auricular therapy for stimulating the ear acupoints for symptoms management. Such findings have important impact in integrative medicine to enhance the quality of life of patients.
Janet Wong.
Through my research work and community projects, I have strengthened evidence-informed practice to meet the abused women's needs.
From the state of Illinois, Shannon Holloway.
Through my commitment to improving the health of adults who are older, I have developed realistic, tailored biobehavioral interventions to prevent cognitive impairment in those who experience disparities in their risk. I advocate for practical, scalable strategies to ultimately influence health policy.
Colleen J. Klein.
My career has been devoted to the preparation and development of competent nurses. Through my research and federal grants writing, the impact to health has been through the advancement of telehealth programs designed to serve rural populations and to the expansion of postgraduate fellowships for advanced practice providers.
Masako Mayahara.
Poorly managed pain at the end of life is a serious public health issue. Throughout my career, My goal has always been to discover the most innovative and impactful solutions possible to provide safe and effective pain management to patients affected by advanced illness.
Lauren Source.
My work has fostered healthcare transformation for children through multi-professional initiatives and interorganizational partnerships in pediatric critical care. I brought in pediatric critical care nursing's presence worldwide, leading to a more equitable voice for nursing as an important contributor to the healthcare team.
From the state of Indiana, Sharon Crowder.
Through my innovative models for health policy education and mentorship, nursing students, faculty, and clinicians are influencing health policy and the advocacy that improves health outcomes.
Leslie Olek.
My contribution has included providing treatment, education, and support to patients, families, caregivers, students, and communities affected by mental illness, substance use, and other health-related challenges, as well as influencing state and national legislators to support health, mental health, and pro-nursing legislation.
Kimberly Tharp Berry.
Through my work, I think God has given me people and talents and gifts to meet people where they are. So I'd like to think that I've impacted healthcare by doing exactly that, meeting people where they are in education, in leadership, and in my work with human trafficking, sexual assault victims, and domestic violence.
From the country of Ireland, Fiona Timmins.
I believe my greatest contribution has been facilitating international conversations and dialogue between nurses and other nurses, and between nurses and other healthcare professionals. Firstly, through my research. For example, I'm speaking to you today from Wiesbaden, Germany, where I'm attending a research meeting, and also through my work as editor-in-chief of the Journal of Nursing Management. Never has there been a time when such conversations have been so important globally for our future.
Our next honorary fellow is Carolyn Jones. Ms. Jones is the president and CEO of Carolyn Jones Productions and founder and president of the 100 People Foundation. As a photojournalistic storyteller, she believes that stories have the power to change the human condition when presented in an authentic way. Ms. Jones is well regarded for her significant efforts to amplify the voice of nurses on the front lines of our healthcare system through photography and film. Her interest in nursing grew from her personal experience with breast cancer. Through her journey as a patient, she was struck by the level of knowledge, insight, skill, and empathy that nurses caring for her possessed. Her most widely acclaimed book publications include Living Proof, Courage in the Face of AIDS, exhibited at the United Nations World AIDS Conference, and The American Nurse, which led to a feature documentary that has been included in the 2015 U.S. State Department's American Film Showcase. Her second film, Defining Hope, represents the culmination of a journey investigating how we can make better end-of-life choices. It was awarded Best Premiere Documentary Feature at the Heartland International Film Festival and aired over 1,000 times on PBS stations nationwide. Her most recent film, In Case of Emergency, won the Grand Jury Award for Best Documentary at the United Nations Association Film Festival. Dr. Jones founded the nonprofit 100 People Foundation, through which she travels the world, sharing stories that celebrate our global neighbors. She was honored as one of 50 everyday heroes in the book that title for her work with the 100 People Foundation. Ms. Jones has been recognized for her contributions to the nursing profession with an honorary doctorate in fine arts from the State University of New York and an honorary induction into Sigma Theta Tau, as well as the Academy of Emergency Nursing. Ms. Jones, we are delighted to welcome you to the Academy as an honorary fellow.
Thank you. My goodness. So, listen, I gotta say this. You've probably heard this 1,000 times already, but so I'm a filmmaker, right? And we're all dressed up. You're all looking absolutely beautiful. I haven't seen my husband in a suit in 3 years, so this is exciting on a lot of levels. And I'm standing here at a podium, starting a sentence with, "I'd like to thank the Academy." And it begs the question, where is the Oscar? So I look out among you and I see so many people who've helped me make these projects possible. And there are 3 women in particular I just have to call out. First of all, Patty Howard, Kate Fitzpatrick, and Anne-Marie Papa. They are, first of all, like they opened the doors to their hospitals and let me film in their hospitals, which was amazing. It's a miracle these women are even speaking to me, let alone nominating me for anything. So, and for those of you who have given me your cards and given me your numbers and said, call me when you're doing your next film, I just want you to know you're on a list. Be careful what you wish for, and you'll probably hear from us. You know, I just want to take a moment as an outsider looking at your profession to just tell you how I feel about what you do. It's just been such an extraordinary journey for me to learn that. And I think you're in a really unique position, kind of a bird's eye view of mankind, of human beings, of who we are, of humanity. And I'm so impressed by that. You know better than anybody that we all have all these facades, right? There's all this veneer on us. But right underneath the surface, we all have a circulatory system and a nervous system and a heart and a couple of lungs. And you know that better than anybody. And that connects all of us. And I find that really beautiful. And it makes me think of Carl Sagan saying that we are all this stuff of stars. And I love anything that connects us. That's really what I'm all about. We live in a really difficult time, I think. It's very divisive out there. And I've often said that I think there's a lack of decency in the world, but not here. And there's a certain abundance of decency and kindness in the profession of nursing. One of my favorite photographers is a Brazilian photographer named Salgado, and he spent his entire career going all over the world capturing injustices and man's inability to deal with others and just the horror of what life can be. And at the end of his whole career, he said, you know, hatred is contagious, but so is kindness. And I couldn't agree with him more. Kindness is really contagious. And that's what I've learned from all of you. I think it's such an important time to tell your story, and it is my greatest privilege to get to do that. So I have every intention of keeping on going with this path that I'm on, and this is the fuel for my fire. So thank you so very much.
From the state of Kansas, Vancella McCreary Jones.
My contributions have improved health outcomes via enhancing the health literacy knowledge of nurses and other practitioners as well as informing the research of national and international colleagues in nursing and other disciplines.
Wilaypan Rojajanis Rat.
My significant contributions are advancing scientific knowledge through lactation research and the promotion of breastfeeding among employed mothers. I hope my work continues to impact healthcare practice, community, and the state policy in breastfeeding support for employed mothers.
From the state of Kentucky, Candace Harrington.
Older female family caregivers of those with Alzheimer's disease and Alzheimer's disease-related dementias are vulnerable and socially marginalized, especially in rural communities. I dedicate my research, practice, and service to eradicate the power inequities, systemic racism, and ageism that are contributing to their health disparities.
Anna Maria Linares.
My most significant contribution to health is advancing scientific knowledge through lactation research and translational science, with an emphasis on promoting exclusive breastfeeding for the first 6 months of life in racial and ethnic minority groups at the local, national, and international levels.
Eric Martin.
I've been passionate about advancing nursing leadership and strengthening the next generation of nurse leaders. My efforts to reduce workplace violence, support diversity and belonging, and design healthy and inclusive work environments to recruit and retain new talent are being leveraged by thousands of healthcare leaders internationally and will help our profession continue to transform and advance health for all.
Gia Mudd Martin.
My collaborative research with Latino-Latina, rural, and Appalachian communities has resulted in a sustainable model of community health worker-led interventions to reduce cardiovascular disease and type 2 diabetes risk in at-risk families. This model is also being leveraged to increase COVID-19 vaccine uptake and is foundational to a national network to reduce health disparities in historically marginalized communities.
From the state of Louisiana, Laura Bonanno.
Through my leadership and advocacy, nurse anesthesia education was advanced with the development of a competency-based clinical assessment tool and revision of the Council on Accreditation standards to ensure that nurse anesthesia graduates are competent anesthesia providers prepared for full scope of practice who provide safe, quality patient care.
From the state of Maryland, Wanza Bacon.
My seminal contribution to nursing is leading national efforts to improve disaster preparedness and response across the nation. These efforts have resulted in community stabilization, staffing healthcare systems, and meeting the needs of Americans during the COVID-19 pandemic and immigration crisis.
Susan Benden.
Throughout my career, I've worked to develop the skills, confidence, and competence of others, specifically other nurse educators in practice and academic settings. Through them and their outstanding work, I've influenced clinicians, change agents, and leaders to help improve the health of individuals, families, and communities.
Kelly Bauer.
My research has illuminated the structural determinants of maternal health inequities. I've implemented programs to promote equity, including implicit bias training for 3,000 maternal health professionals in Maryland. And I've led educational initiatives to redesign nursing curricula that prepares our nursing workforce to advance equity and to provide gender-affirming care.
Deborah Bush.
I'm a pediatric nurse practitioner, educator, and a researcher of 11 QI studies and projects. I'm the author of the Tri-Core Breastfeeding Model that has been adapted by NAPNAP, national agencies, and statewide agencies to guide primary care lactation practice.
Kelly Duran.
My contributions to health have been in reducing health inequities. In my research, I've created a worksite wellness program with long-term care staff that can improve staff, resident, and organizational outcomes. In my practice, I've worked with populations eligible for Medicaid to address social determinants of health and health literacy.
Kelly Gleason.
The contribution I am most proud of is increasing digital access for older adults in the community during the pandemic.
Marion Grant.
I left a career as a cover girl and Max Factor marketing executive to become a leading voice for national palliative care public policy and to increase access to palliative care for those living with serious illness and their families.
Heather King.
It is an honor to join the American Academy of Nursing. I have tirelessly championed the professional development of military nurses, healthcare professionals, and leaders to conduct rigorous research and evidence-based practice within the military healthcare system. It is an honor to serve with nurses across the country who always rise to the challenge.
Karen Cavirno.
I've impacted health through my work to develop psychiatric mental health nurse practitioner competencies and curricula with a focus on integrating mental health care into primary nurse practitioner practices, and through national and international collaborations to develop new advanced practice mental health nursing roles and programs that increase access to mental health care.
Aisha Mitz.
In the United States Public Health Service, I impact health and lead policy and program development that links public health not only with primary care, but also with our acute care health delivery systems. I have and I will continue to drive diversity among nurse leaders, increase nursing leadership opportunities at all levels of government, and solidify the role of the public health nurse in achieving health equity not only in the nation, but across the world.
Michelle Patch.
My internationally recognized scholarship and clinical practice have positively impacted patient, staff, and public health safety, specifically during times of crisis, violence, disaster, and trauma.
Marianne Shaughnessy.
I hope my contributions have had an impact on the care of older adults through the students I've taught, the manuscripts I've published, and the programs I am now privileged to administer at the VA's Office of Geriatrics and Extended Care.
From the state of Massachusetts, Dallas Dunkar.
We know that gender-affirming care is simply good health care. I will continue to fiercely advocate for the life-saving right for all trans and gender diverse people to be seen, heard, and cared for.
Heidi Fantasia.
I'm a national expert in women's health. Through my work, I have shaped women's health policy, set national research priorities, and established best practices for women's health care.
Sun S. Kim.
My contribution to health is addressing health disparity in tobacco control. I have conducted numerous smoking cessation studies for the past 20 years, especially focused on underserved population, such as Asian immigrants and women living with HIV, whose majority group is African American.
Marcia Maurer.
from my earliest days as a nurse, setting standards of care for patients with HIV and substance use disorders, to my leadership work, developing nursing career paths. I've devoted myself to ensuring equitable care for all patients and addressing career advancement barriers faced by nurses from historically marginalized groups.
Susan Mullaney.
My contributions to health focus on activating and empowering nurse practitioners to engage in policy and advocacy efforts that improve access to high-quality, cost-effective healthcare for our diverse aging population.
Rita Olens.
By 2050, the UN estimates that greater than 10 million extra deaths each year will be caused by multi-drug resistant organisms. Throughout my career, I have published and worked with many organizations to integrate bedside frontline nurses into an appreciation and practice of antimicrobial stewardship.
Catherine Simmons.
I've been working in the area of reproductive justice for over 30 years and specifically focused on abortion and abortion access. So clinical practice, education, and advocacy. In recent years, I've shifted to also focus on climate justice, and I'm particularly interested in the intersection of reproductive justice and climate justice. And I'm also adding in rural health access.
Ashley Waddell.
By engaging nurses and leaders in state health policy, my contributions have impacted access to healthcare services, professional practice and licensure regulations, and state workforce strategies. Together, these policies impact health.
Yi-Chun Ye.
My contribution to health is through my research on sleep promotion and management of sleep disorders. As a nurse scholar leading interdisciplinary investigation, I have amplified the voice of nursing science and directed research priorities in sleep health.
From the state of Michigan, Dixie Ahn.
Throughout my career as a 35-year Navy veteran, my greatest contribution to health has been fostering a personal and professional practice environment which enhances shared decision-making, clinical excellence, lifelong learning, and the well-being of staff, patients, and families in a safe and supportive practice environment.
Elizabeth Duffy.
My most significant nursing contribution has been to promote evidence-based nursing care and improve the outcomes of children with cancer. I have led and mentored interdisciplinary teams at the National Cancer Institute Children's Oncology Group to draft and publish evidence-based practice recommendations aiming to elevate the quality care of children worldwide.
Jiaying Ling.
My most significant contribution to health is advancing family health promotion through implementing and disseminating cutting-edge, family-centered biobehavior interventions to reduce health disparities in childhood obesity.
Michelle Monroe Kramer.
Gender-based violence affects 1 in 3 women and girls globally and is a nursing issue. Through global research and leadership, my collaborative work aims to develop holistic life skills approaches to gender-based violence prevention and response among university students in the United States and Sub-Saharan Africa.
Charles Yingling.
Through my work, I've developed innovative nurse-led academic practice partnerships that expand access to care for and improve health in historically marginalized communities. I create nurse-led models of care to reach communities and groups that have experienced disinvestment. My leadership in creating academic practice partnerships serves as a national model to enhance education, practice, and policy and improve population health.
From the state of Minnesota, Sherry Friedrich.
Through creative and innovative educational approaches like healthcare escape rooms, health professional learners develop the skills they need to be collaborative members of high-functioning teams. The relationships formed within these teams and with our patients will contribute to improved patient outcomes and will ultimately lead to better health in our communities.
From the state of Mississippi, Elena Harrington.
My focus has been to enhance the effective use of simulation education. I develop simulation accreditation and certification resources for organizations around the world, strengthening the quality of their programs. I hope my work helps generations to come by improving their performance and reducing errors in patient care.
From the state of New Jersey, Lydia Albuquerque.
I will continue to educate, empower, and advocate for vulnerable populations, especially women, at high risk for cardiovascular disease and stroke. Increasing physical activity with wearable technology such as Fitbit and virtual peer support has demonstrated reduction in BMI and improved quality of life among women.
Carrie Maestro.
My contributions span executive leadership, care delivery, and health policy. As a leader and scientist, my influence has maximized children's health outcomes and minimized childhood morbidity and mortality at the state to international levels. I designed, tested, and broadly disseminated findings for an innovative patient and family-centered care delivery model, and I continue to provide a venue for diverse and inclusive partnerships addressing health equity and modern issues confronting children and adolescent health.
Jasper Irwin Talaba.
Through my work in advocacy for all internationally educated nurses immigrating to the United States, they adjust into their new community with ease, as well as transition into practice settings successfully. In addition, I'm a strong proponent for the advancement and implementation of advanced practice nursing nationally and globally.
From the state of New York, Adriana Archa.
My work has advanced the science of using visualizations like infographics to make it easier for people to understand and use their health information regardless of English proficiency or literacy level. I have contributed valuable insights into what makes a visualization comprehensible and refined participatory design methods that center the needs of the viewer.
Susan Blakeman.
My work has impacted health through innovative interventions in interprofessional education, practice, and research aimed at addressing health disparities and trauma in persons with mental illness and from historically marginalized groups.
Carol DiBello.
The focus of my nursing career has been in the care of individuals with chronic and serious illness and their caregivers. I bring that focus today as a nursing educator to assure current and future nurses have the skills needed to promote the best lived experience of illness possible in the patients they care for.
Nicolette Fiore Lopez.
I create innovation in patient care and staff safety. I strategically lead nurses who impact health. I impact health through legislative advocacy and mentor nurses to lobby legislators. I expand our voice at state and national levels by increasing the number of nurses on boards.
Barbara Glickstein.
Media is my public health practice. I've documented the underrepresentation of nurses as expert sources in health news media, prepared them in strategic communication and how to engage the media, and worked with journalists to use nurses as sources to advance population health.
Jared Cutson.
planning, implementing, and evaluating innovative educational curriculums utilizing simulation and virtual reality, and integrating this with the testing of systems processes has led to improved patient outcomes across the board in both the pre-hospital and hospital-based environments.
Fidelindo Lim.
By conducting the first national survey of LGBTQ+ health integration in nursing curriculum, I have advocated for addressing the healthcare disparities of LGBTQ+ populations in nursing education.
Mary Beth Massey.
I strive to educate our nurse anesthesia residents in the facts that we're just not looking at the patient coming to the operating room. We're looking at their entire life and what they're bringing with them there. It's definitely a holistic approach, and I think that we have to look at every part of this process along the way. I really hope that I inspire diverse registered nurses that become nurse anesthesia residents along the way to be part of the community that they live in and that they work in.
Marlene McHugh.
My impact has been in practice and education through my work as a clinical scholar who has maintained a clinical practice for many years in an academic health center, both inpatient and outpatient, and during the height of the COVID surges in the Bronx. I have taught in the nation's first clinical DNP program. I've partnered with nurse researchers across the globe to improve the science of palliative care.
Renee McLeod Sorgen.
Talking with patients and being present during their most difficult moments is what I relish as a nurse. My most significant contribution to nursing has been advancing clinical ethics consultation in education and practice and research so that those that are most underrepresented and disenfranchised have a voice. Better communication leads to better health.
Joan Mirabai.
My contribution to health is dedicated to patients with chronic neurologic disorders. I strive to increase access to quality care by education of clinicians on the interdisciplinary team. I also strive to improve quality of life and advance health equity for patients and families with Parkinson's disease.
Mary Moran.
As a nursing educator, I wish to prepare nurses to meet change in healthcare with resilience, empathy, vigor, and scholarship, so that they can produce the best of healthcare to all people.
Ronika Mukherjee.
My work focuses on documented or irregular migrants, people with disabilities, substance use disorders, and LGBTQ+ peoples. My clinical care, teaching, and writing all work to challenge borders, prisons, police, and the ways they create suffering and reinforce systematic exclusion.
Beth Oliver.
As the first nurse to be president and chairman of the American Heart Association New York City chapter, I have dedicated my career to developing training programs and policies that impact health outcomes of the diverse communities we serve. In addition, my work has focused on nursing's role in the development of innovative models of care to address the challenges brought forth by the global pandemic.
Edmund J.Y. Pajarillo.
My contributions highlight the importance of informatics to enhance nursing as we advocate for ourselves, our patients, and create transformational innovations, as well as hone in on synergistic outcomes of collaborative initiatives.
Pamela Stewart Fays.
I'm passionate about rural nursing. My impact on the health of rural people has been through advocacy, as well as the education of rural nurses and nurse scientists. Nurses are the backbone of rural health care and need a deep understanding of rural culture. I advocate for and provide a voice for rural nurses.
Carolyn Sun.
As a nurse scientist, my research has focused on improving health disparities, both locally and globally, by using technology to improve nursing practice and an academic partnership with a major hospital system to test innovative technology while supporting and training bedside nurses to develop their own research interests.
Maxim Topaz.
My most significant contribution is introducing artificial intelligence-based technologies to nursing. My research is used internationally to provide more precise care to patients across care continuum using these cutting-edge technologies.
From the state of North Carolina, Bimbola Akantati.
My service-focused contributions have improved health equity and strengthened nursing capacity nationally, with sustained leadership focused on diversity, equity, and inclusion, and strengthening nursing capacity globally by developing a public health model that creates access to primary health care.
Michael Carey.
In my research, I use big data and machine learning as transformative tools for advancing health equity and eliminating health disparities. Dually trained in clinical research and health data science, I lead multidisciplinary teams in mitigating the harmful effects of racial bias in health algorithms deployed in systems and models of care.
Kay Cohen.
The most significant contribution to health I have made is in improving the nursing care of children and their families as an educator to nursing students and as a co-author of 3 nursing textbooks. These textbooks provide up-to-date information related to nursing care of children and are used by thousands of nursing students throughout the U.S. and abroad.
Laurie Kennedy Malone.
Through my work as an advanced practice gerontological nurse educator, I've contributed to the health of older adults through service in leadership positions in national organizations, publication of textbooks for advanced practice nurses, and the creation of innovative clinical video simulations.
Sharon Pierce.
I designed the first ever candidate school for nurses and created Influential Nurses, a site to empower them to run for political office. In addition, I co-host one of the top 50 medical podcasts in the country, amplifying our voices as the backbone of the healthcare system.
Shanita Randolph.
My research in partnership with beauty industry professionals is transforming health and advancing equity with and within communities of color. We are developing culturally relevant interventions, engaging the community throughout the research process, and implementing nurse-led, non-traditional models of healthcare delivery.
Kenneth Remfer.
Under my leadership and advocacy, nurses have embraced their role as agents of social change. Recognition that nursing is a unique discipline, separate from but still interdependent with medicine, has allowed nurses to leverage their influence and subsequently impact global issues, including access, health equity, and health economics.
Christopher Stuckey.
My professional impact focuses on service to the nursing profession through leadership, advocacy, policy efforts, and research to enhance clinical nursing outcomes and improve the work environment for perioperative registered nurses.
LaShonda Wallace.
My contributions to interdisciplinary, community-based collaboration and the meaningful involvement of persons with the HIV diagnosis have contributed to healthcare delivery in medical deserts. As a fellow, I will continue advocacy to support the needs of disenfranchised populations and the efforts for transformative practices to achieve healthcare equity.
Jing Wang.
I am committed to improving care quality and health equity
for older adults and their caregivers through my leadership engagement in developing culturally sensitive, person-centered care programs in low-resourced environment.
Rosemarie Xavier.
My most significant contribution is the expansion of neuropsychiatric symptom science research. I lead an interdisciplinary and diverse team of established and young scientists. We work together to identify genetic and other biological insights to improve care for the severely mentally ill.
The Academy is honored to designate the Honorable Benny Thompson as an honorary fellow. Representative Benny Thompson has served in Congress for over 28 years, representing the state of Mississippi. He has spent his career advocating for the voiceless. While attending Tougaloo College and Jackson State University, he joined the Student Nonviolent Coordinating Committee and helped to organize voter registration drives for African Americans in the Mississippi Delta during the Civil Rights Movement of the 1960s. After serving as alderman and mayor in his hometown of Bolton, Mississippi for 12 years, he served as Hinds County Supervisor for 13 years before being elected to Congress in 1993. Throughout his tenure, he focused on social and structural determinants of health, such as improving roads, water and sewer systems, as well as housing. He was an early supporter of nurses during the time in Hinds County, partnering with local leaders, championing matters such as equitable pay and staffing, as well as working to close the gap in healthcare disparities through legislative policymaking and promoting equitable care. Notably, Congressman Thompson authored the Minority Health and Health Disparities Research and Education Act of 2000 that created the Office of Minority Health and Health Disparities that later became a center and now is the National Institute for Minority Health and Health Disparities at the National Institutes of Health. After Hurricane Katrina ravaged the state of Mississippi, Congressman Thompson aggressively advocated for disaster relief improvements within government agencies, in particular FEMA. Having entered public service in 1968, he is now the longest-serving African-American elected official in the state of Mississippi, known to fight for the poor and underserved populations of Black, brown, and indigenous people of color across the United States. It is a true honor to welcome Congressman Thompson as an honorary fellow of the Academy. As you can imagine, with the 2022 election right around the corner, Chairman Thompson could not be with us this evening and has a recorded message.
Hello, I'm Congressman Benny Thompson. I'm thrilled to accept the designation as Honorary Fellow of the American Academy of Nursing. First, I'd like to thank my sponsors, Elisa Georges, Linda Burns Bolton, and fellow Mississippian Rita Ray. I've gotten to know these incredible nurses, leaders, and health equity champions over the course of my career. The American Academy of Nursing's vision of healthy lives for all people truly resonates with me, as I've spent my entire life fighting to improve the lives of all people. I've seen firsthand the power nurses have positively impact and transform their community, locally as an alderman in my hometown of Bolton, Mississippi, and on the regional level and nationally as the longest-serving African-American elected official in the state of Mississippi. Nurses are problem solvers and coalition builders. These core tenets are also the foundation of my successful legislative career. It is my understanding that the American Academy of Nursing is approaching an important milestone and will celebrate its 50th anniversary next year in 2023. In 1973, 36 charter fellows came together to establish the academy. Among these great leaders are two notable black nurses, Rita Dumas and Geraldine Felton, that played a critical role in shaping health policy at the federal level. Rita Dumas, she was the first woman and first nurse to serve as a deputy director of the National Institute of Mental Health. And Geraldine Felton served as a deputy director of the Department of Nursing at Walter Reed Institute of Research. She also was a vocal advocate for the National Center for Nursing Research, now NINR, to be housed in NIH when it was first established. The Academy continues to uphold its historical commitment to its vision and advancing health equity through its work in various events, such as the 2020 Institute for Nursing Leadership's critical conversation on health equity and racism, the 2021 Policy Dialogue on mitigating and responding to racism, discrimination, and the 2022 webinar on creating a culture of belonging within the nursing profession. The Academy's Edge Runners Initiative celebrates innovation within the profession to elevate new models of care that will further eliminate disparities in access and the care provided to patients. And the Council for the Advancement of Nursing Science highlights the research our nation nurses are conducting, especially through the year's State of the Science Congress on Nursing Research, focused on the social and structural determinants of health. I look forward to collaborating with the American Academy of Nursing Fellows to continue to close the gap in healthcare disparities through policymaking and promoting equitable care to advance the health of poor and underserved people in my state and throughout the United States. Thank you.
Amazing. So now we're going to continue with recognition of our new fellows, starting with the country of Norway, Marit Kirkevoid.
I initiated and led the implementation of teaching nursing homes in Norway. These institutions, now in existence for over 20 years, have significantly impacted quality improvement and research into aged care, thereby improving health and well-being for older people across the country.
From the state of Ohio, Gail Bagwell.
The most significant contribution that I have made to health is in the care of preterm and high-risk neonates and their families, which has led to improved outcomes. The areas of specialization is caring for neonates with neonatal absence syndrome and for improving safe sleep for babies in their first year of life.
Susan Bramer.
Through my research, teaching, and service as a psychiatric mental health nurse, my impact on health has been to decrease stigma nationally and internationally against people living with a mental illness.
Stephanie Griggs.
My contribution to research and practice has been to alleviate the burden of type 1 diabetes by addressing multiple dimensions of sleep health through human-delivered interventions. Technology in my interventions is used to enhance the human-to-provider connection.
Michael Johnson.
My research has led to significant impacts on national level policies that protect and improve the health of lesbian, gay, bisexual, and transgender people.
Scott Emery Moore.
My contribution has impacted health
through advocating for sexual and gender minority inclusive and affirming practices across care settings, in nursing curricula, and in nursing schools.
Sonia Moore.
Through my work as a persistent advocate for a population-identical workforce and to advance the career development of underrepresented persons, I have been committed to promoting a diversity, equity, and justice agenda nationally and internationally through innovative practice and programming.
Andrew Reamer.
I aim to improve the delivery of healthcare by transforming the way we approach moving patients to the appropriate level of care. My work focuses on generating evidence necessary to develop decision support systems to guide patients, families, and providers as they engage in this complicated decision of whether to move to another hospital and how and when the transfer should take place.
Margaret Souders.
I've dedicated my nursing career to the practice, education, and research, caring for children with autism spectrum disorder and their families. And I've been helping them fall asleep and stay asleep with cognitive behavioral therapy for insomnia tailored to their individual needs.
Judith Tate.
My life's work has been to improve communication with and outcomes for patients and families, both within the ICU walls and after discharge.
R. Lee Tyson.
My contribution has impacted health by building innovative, scalable, nurse-led practices to address psychiatric needs, foster healthcare equity, and mitigate provider shortages across the nation. The combination of my business, clinical, and academic backgrounds have expanded access to mental wellness and inspired an upcoming generation of nursing entrepreneurs.
Melissa Wilson.
As a nurse scientist for the United States Air Force, I am currently working on the topic of moral distress in military healthcare providers. In addition, I've had the opportunity to work on addressing acute pain and integration of other health technologies into the air medical transport system.
From the state of Oklahoma, Emily Jones.
My work as a nurse scientist, tribal community research partner, and advocate impacts the evolving U.S. indigenous maternal health research landscape and advances perinatal life course health equity.
From the state of Oregon, Quinn Denfeld.
Through my research, I have generated a clinically relevant knowledge base to support the care of adults with cardiovascular disease, particularly those with heart failure and especially among women. I focus on improving patient-reported outcomes such as symptoms and frailty. I also work to amplify and shape global nursing science through my leadership in interdisciplinary organizations and journals.
Casey Shillum.
Through writing, implementing, and evaluating health policies at local, state, and federal levels, I have ensured access to advanced care planning and palliative care, and created mechanisms for government, communities, and providers to support the 53 million family caregivers who provide unpaid care and services for older adults and people with disabilities.
Ellen Tilden.
I focus on science, innovation, and policy that helps childbearing people access care best matched to their needs. This includes defining safe reduction in cesarean delivery, increasing equitable access to doula and midwifery care, and incorporating behavioral health into prenatal care. My North Star is to decrease maternal morbidity and mortality in the U.S.
From the country of Pakistan, Rosina Carmelini.
Help reduce gender-based violence, improve adolescents and women's mental well-being and empowerment,
in underprivileged communities, while contributing to higher education in nursing for improved health systems in Pakistan and in the region.
From the state of Pennsylvania, Deborah Dillon.
Advocacy work and policy changes at the state and local level. I've expanded the scope of practice for nurse practitioners, enabling them to practice to the full extent of their licensure. This impacts access to health care for nearly 1,000 individuals. By launching the careers of over 300 nurse practitioners, patients now have increased access to this group of healthcare providers.
Dalmacio Flores.
Our work under Penn Nursing has resulted in family-based interventions that provide guidance to parents on how to have inclusive sexual health conversations, especially germane for youth who have emergent same-sex attractions, behaviors, or identities.
Sarah Jacoby.
At Penn Nursing, I work to advance our understandings of the etiologies that underlie persistent and racialized health inequities long associated with traumatic injuries and violence, and with this, develop and test interventions that incorporate the interrelationship between injury risk, recovery outcomes, and the socio-structural determinants of health.
Dondra Jones.
Through my work, I have led various advocacy efforts with the goal of achieving health equity for all, and a major focus on taking healthcare out of the brick and mortars of hospitals and physician offices and bringing it right to the community, as well as increasing the diversity of the nursing workforce at every level to reflect the populations that we serve.
Rhonda Manaval.
Through my work as a nurse educator and academic leader, I've had the opportunity to impact the nursing workforce, educational advancement, and career development of nurses in the U.S. and internationally through innovative partnerships and programs and by promoting scholarships and retention of diverse learners.
Kate Morse.
Creating transformative learning experiences that empower our current and future nurses to find their professional voices and represent our perspective in interprofessional teams to positively impact patient outcomes is my most important contribution.
Joseph Napolitano.
My contributions have increased the number of nurses in the workforce, enhanced the diversity of that workforce, and in turn, improved the health of all in the region, the state, and the nation.
John O'Donnell.
In my work as a nursing and nurse anesthesia leader, I've guided more than 1,000 ICU nurses to become CRNAs, providing more than 1,000 high-quality anesthetics every year, an impact on the health system of more than 1 million patients annually. My work in simulation faculty development has had similar impact for healthcare educators, clinicians, and their students around the world.
Bridget Rice.
I use research as an advocacy tool to promote equity and justice in health for marginalized populations. I believe that nurses can change the world one community at a time.
From the country of the Philippines, Michael Joseph Dino.
Mabuhay, a Filipino greeting meaning long live. So is my leadership and scholarship in client-centered telehealth, simulation, and robotics to improve health everywhere. My gratitude to everyone and the Academy for this humbling experience, which inspires me to further my high-tech, high-touch care across spaces, physically, virtually, and in the metaverse.
From the country of Puerto Rico, Shirley Piera Morales.
nurse with specialty in anesthesiology, educator, leader, and researcher, my most significant contribution impacted health includes increasing the access of Hispanics to pain management in the postoperative phase, increasing the awareness of opioid dependency, and teaching others the importance of wellness as healthcare providers.
From the country of Romania. I hear ya. From the country of Romania, Nicoleta Matria.
Through every action that we as nurses do, through every patient that we are caring for, through every family that we are offering support to, through every nurse that we are educating, through every policy or law that we are influencing change with.
From the country of Rwanda, Judy Kanyula.
I'm dismantling racist, patriarchal, and colonial mindsets and structures to allow the vast majority of Africans to access competent and compassionate care.
Donatilla Mukamana.
My leadership and research supports the most vulnerable community. I developed the biopsychosocial model for survival of genocidal rape that occurred in genocide against Tutsi. I initiated 8 postgraduate programs in nursing at the University of Rwanda and amplify the voice of nursing science in global conversation.
From the country of Saudi Arabia, Ahmed Abashaka.
As a leading figure and first nursing professor in Saudi Arabia, my contributions include pioneering the first PhD program in the region and the Saudi Nursing Association. I am honored to be the first Saudi nurse to receive the FAM.
From the country of Singapore, Yan Hong Dong.
My contribution has improved brain and cognitive health in patients with vascular diseases. I hope to continue to derive novel solutions in science of care through translational clinical research in heart and brain connection.
From the state of South Carolina, Katie Chargaloff.
Through my work, health is positively impacted by preparing nurse educators to integrate veteran care competencies into nursing curricula, while also engaging medical surgical nurses in research to address health inequities that resulted in significant reductions in post-transplantation early hospital readmission rate.
Stephanie Davis.
Through leading 11 medical trips with volunteers and medical missions, my teams have provided $1.2 million worth of health care to over 8,000 people in Ecuador, Honduras, and the Dominican Republic. 194 graduates have been educated to provide interculturally competent care. And through grant funding, 30 nurse practitioner graduates will provide primary care in 6 Appalachian counties.
Robin Dawson.
Nurses have always known that effective communication skills are foundational to excellent and equitable patient care, especially when grounded in compassion and cultural respect. My research focused on technology-mediated communication will enhance our understanding of patient-provider interactions and how we teach communication skills to our next generation of health professionals.
Betsy McDowell.
Through academic, clinical, and leadership activities, I have successfully blended theory-based education and practice, contributing to the diverse nursing workforce, providing holistic care for various client systems.
Crystal Murillo.
As
As nurses, we have a code of ethics requiring that we act on social and structural injustices that continue to plague our healthcare system. My work focuses on using simulation as a means to achieve health equity by designing experiences that allow nursing students to view themselves as social justice advocates for health equity.
From the state of South Dakota, Robin Ahrens.
My contribution to health is through the use of policy and advocacy to reduce barriers so that patients can access the provider of their choice. I also work to increase access to healthcare through policy and advocacy and through the use of telehealth.
From the country of South Korea, Hee-sung Choi.
Every voice has the right to be heard, and every human has the right to be respected and happy. This belief has been at the core of my work regarding prevention of adolescent suicide and workplace violence. As a nurse educator and researcher, I hope that my work can promote mental health for everyone, but in particular, the culturally marginalized.
Duk-yu Jung.
Through my research, I improve quality of life of older adults dwelling in long-term care facility and community. As a nursing educator and scholar, I have educated nursing students and developed evidence-based protocols.
From the country of Sweden, Ulrika Nilsson.
I have contributed with research evidence about nursing interventions that could improve patients' post-operative recovery. Interventions that has been implemented in clinical care, such as digital follow-up and support by nurses.
From the country of Taiwan, Hui-ying Chiang.
The most valuable contribution to health I have made include programming junior nurse leadership, introducing international clinical nursing training, building nurse preceptor-led system, policymaking of nurse practice scope at the national level.
Min-hui Chung.
A nurse, educator, and research scientist, I focus on mental health and safety focus in patients by developing innovative research. Our research can provide evidence to change practice guidelines and improve influence of mental health policy and improves patients' quality of life.
Sui Yuan Huang.
Throughout my career, I have observed the trajectory of patients with heart failure and designed the evidence-based intervention to improve their quality of life. I hope that my work will continue to improve the lives of not only my fellow Taiwanese, but people across the world.
Jin Jiyuan Liao.
My research developed a supportive care bundle to improve preterm infant sleep and minimize their pain and stress, provide evidence for guiding clinicians to advance care and promote infants' outcome. Importantly, the findings have great impact on developing guidelines for management of infant sore pain and stress worldwide.
Mie Fang Lu.
Through my work on needs and comfort-based studies, findings have been used to set up care centers and used in nursing education, which further refined the test question for nursing license examination in Taiwan.
From the state of Tennessee, Kelly Aldrich.
As an informatics nurse specialist, my contributions to health are in technology policy, national standards, and creating innovative and transformative solutions at scale. that for the nurse, simplify workflow and reduce burden to improve the nurse's experience in providing seamless and safe patient-centered care.
Elizabeth Card.
I hope my work on improving nurses' work environment will contribute to policy changes with application of innovative solutions to nurture new nurse scholars, to amplify our nursing science voice, and to elevate nurses' contribution to healthcare.
Laurie Connors.
My work in biobehavioral research supports personalized health care for individuals and families at elevated risk for cancer. And through my NIH-supported research education program, TIGER, I plan to increase capability and capacity of genomics-informed nursing to improve healthcare equity and access for person-centered care.
Marilyn Dubree.
My contribution to health is based on a commitment to each individual staff nurse and leader in our system and throughout our country and our world. I believe each individual brings the best of themselves to nursing practice and nursing leadership, and my career has been focused on helping individuals find that in the work that they do.
Wakako Eklund.
My contributions to the neonatal textbooks, both here and abroad, in conducting and sharing the global neonatal research results, fortify the neonatal nurses' education and training globally to impact the health of the newborn and the families that we care for.
Sadie Hudson.
My contribution to health is improving the clinical care and scientific understanding of individuals living at high genetic risk of cancer, living in rural and underserved areas. I hope I can continue to inform practice by designing unique patient-centered interventions and training other nurses to extend cancer genetic care in underserved communities.
Brenda Kulhanek.
The practice of nursing is enhanced and health is impacted when nurses are able to practice confidently in a digital healthcare environment. Innovative educational solutions provide essential informatics competencies for nurses to increase efficiency, improve patient safety and quality, and decrease nursing burnout.
Tonight, it is our pleasure to recognize Dr. Bei Wu as the Honorary Fellow of the Academy. Dr. Wu is an eminent international leader in aging and health. She has increased the knowledge base of the lived experience of frail older adults and their quality of life. She is widely known as the first social scientist to show the links between poor oral health and cognitive loss among older adults. Her focus on the chronicity of illness, social determinants of health, and aging has informed numerous healthcare professionals and researchers. Currently, she is the Dean's Professor of Global Health and Vice Dean for Research at New York University Roy Myers College of Nursing. Yes, I thought you'd like that. At NYU, Dr. Wu has also held several other faculty leadership positions, including the Director of Global Health and Aging Research, Director of Research for the Hartford Institute for Geriatric Nursing, and the inaugural co-director of the NYU Aging Incubator. She is currently leading several NIH-funded projects, including a clinical trial to improve oral health for persons with cognitive impairment, and a large secondary data analysis to examine how the co-occurrence of diabetes and poor oral health may lead to the development of dementia and cognitive decline. She co-leads the NIH-funded Rutgers NYU Center for Asian Health, Promotion, and Equity. Through this center, she also leads a 5-year intervention study that focuses on supporting Chinese and Korean dementia caregivers who are at increased risk for high blood pressure and diabetes due to the physical and emotional demands of caregiving. Dr. Wu has embraced a cross-disciplinary partnership with nurses to inform our nursing knowledge and grow the nursing profession's ability to have policy impact. Dr. Wu has provided extensive mentorship to dozens of nursing scholars in the U.S. and globally. As one of the leaders of the NIH-funded Asian Resource Center for Minority Aging Research, she has trained dozens of scholars on improving health and well-being of older Asian Americans. Dr. Wu, it is our honor to welcome you to the Academy as an honorary fellow.
Thank you. Good evening, friends and colleagues. It is my true honor and privilege to be inducted to the American Academy of Nursing as an honorary fellow. I thank the award committee for the selection, and I also would like to express my sincere appreciation for the support of Eileen Sullivan-Marks, Beth Merwin, and Judy Haber for my nomination. 28 years ago, when I first came to the country to pursue my graduate degree in gerontology, I came with 2 suitcases and did not even know where I was going to live. That was prior to internet. So since then, I have received so much support from my mentors, colleagues, and friends in nursing. This support has shaped my career in gerontology and nursing, and the contributions that I've made to support the next generation of nurse researchers and to advance nursing science. Over a decade ago, Kathleen Gillis recruited me to the Duke School of Nursing. And thank you, Kathleen. And 6 years ago, I had the pleasure to join New York University Raleigh Myers College of Nursing as the Dean's Professor in Global Health. Throughout all these years, I have the honor of working with many nursing faculties. To name a few, just a few, these mentors and colleagues include Eileen Sullivan-Marks, Jenny Chin Hansen, Ruth Anderson, Tara Cortex, Ellie McConnell, Kirsten Corozzini, Chip Bailey, and Sharon Doherty. This list is very long, so forgive me if some of my colleagues' names are not mentioned here. The reason that I came to this country was to advance my career development and pursue an American dream. At that time, the United States was a land of opportunity. I'm hopeful that this dream is still alive for many people, including nurses, around the globe. Thank you. My personal journey is evidence of nursing's openness and commitment to diversity. It also is a testament to nursing as a global community that puts human dignity and health above all else. Bridging individual stifle or divisiveness. Last but not least, I want to thank my family, my husband Jay Wang, and my daughter Kathleen Wang, who are in the audience. Thank you for your tireless support and unwavering support. Thank you. Thank you. thank you again for this special recognition. I look forward to continue to advance nursing science and the discipline of nursing at large. Thank you.
From the state of Texas, Kong-Ye On.
My earlier research provided critical evidence to transform hospital delay times in treatment of heart attack and stroke. In concert with the research effort, I impacted PhD education for its ultimate goal of human health by advancing science.
Alice Ashcraft.
My work has impacted health through leadership in a variety of nursing organizations that have supported policy changes affecting practice and education. In addition, my program of research continues to focus on nursing home residents and has resulted in the development of an innovative clinical decision support app called Nudge LTC.
Shelby Gardner.
My contribution to advanced nursing science has improved global health as I've come alongside my astute nursing colleagues in India to design and test culturally responsive healthcare simulation, teaching, and learning strategies, building nurse capacity, and mentoring nurse leaders in India.
Deborah Jones.
My contributions have impacted international and national standards of oral care for mechanically ventilated adults and persons with Parkinson's disease, as well as access for communities to achieve optimal oral health. In addition, my contributions have impacted the pathway for a diverse nursing and health professions workforce.
Joan O'Halloran Curry.
The most significant contribution to health I have made is expanding the international education and knowledge of nurses who provide chemotherapy and biotherapy to children and adolescents.
Richard Pullen.
My most significant contribution to health is being a recognized mentor in nursing education and as an expert in autoimmune illnesses. I influence others through service to the public in the discipline of nursing and by disseminating knowledge to guide education and standards of care.
Cindy Sikora.
2 years ago, in the middle of the COVID crisis, I established a COVID vaccine clinic right here in these hallways of the School of Nursing. My colleagues and I, and our students, administered over 128,000 vaccines right here where I stand.
Elizabeth Wells Beatty.
I believe my greatest contribution to the science of nursing is as a disruptive innovator. I hope my contributions continue to impact providers caring for patients who are rurally underserved, suffering behavioral health and substance misuse concerns, and those afflicted by trauma such as sexual assault.
From the U.S. Virgin Islands, Mary Beverly Lancequot.
Through my work as a nurse educator, advocate, and mentor, I contributed to health by increasing the number of nurses, nursing faculty, and nurse leaders across the health nursing sector in the Virgin Islands and the Caribbean.
From the United Arab Emirates, Samaya Abelushi.
The most significant contribution I have made is leading and developing national strategy for nursing and midwifery for my beloved country. I'm leading also a comprehensive initiative to enhance the attractiveness of nursing as a profession in my country, which increased the student enrollment 4 times than before. Through my work in research and policy, my organization was able to respond to COVID-19 pandemic very well.
From the United Kingdom, Leah McAdin.
Education is a vital investment for future workforce development and a critical solution to our rising health and social care challenges to support people living with dementia. I have harnessed technology and pedagogical innovation to introduce dementia training as core undergraduate dementia nursing curriculum in 2 Scottish universities since 2014, and also developed the first comprehensive blended learning resource to train care home staff during the pandemic. I will continue to contribute to dementia workforce development through research-integrated teaching to influence and impact policy and practice.
Laura Sarant.
My most significant contribution to nursing has been through my research, policy and advocacy work around health inequalities, making sure that all patients and communities have an equal chance of good health and life.
Deborah Small.
My innovations include a comprehensive professional practice model and structured safety culture processes. I have helped to elevate nursing nationally and internationally through advocacy, leadership, legislative activities, and publications that better define the role of the nurse and clarify what we actually do for patients and other healthcare workers.
Barbara Stilwell.
Through the varied aspects of my career, I worked alongside nurses to support them in finding ways to advocate for the practices and policies in nursing that we know improve health.
From the state of Utah, Leslie Miles.
Understanding barriers to adult immunizations in the severely mentally ill population has resulted in increased vaccination rates in this vulnerable population. My sexual assault research has increased awareness of violence trends, resulted in policy changes, and improved the care for victims.
From the state of Virginia, Stefan Davis.
Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhuman. So whether I'm guiding organizations to be inclusive or disseminating best practices and influencing their adoption, inspired by King's words, I'm a nurse leader advancing equity for all.
Deborah Gray.
Is a Fulbright Scholar in Sub-Saharan Africa, and through my work with international nursing and healthcare organizations, governmental agencies, and institutions, I developed initiatives guiding global healthcare to increase access, outreach, and capacity, particularly throughout Africa, as well as nursing practice, education, and policy globally.
J.L. Hu.
My research work in nurse anesthesia and implementation science has contributed to developing multiple internationally recognized nurse anesthesia education programs and closing the evidence to practice gaps in the field of nurse anesthesia and pain management.
Terry Jones.
My work positively impacts health through promoting healthy work environments led by innovative nurse leaders with the skills to design and implement sustainable, patient-centered care delivery models.
Jessica Clem Malpass.
I've advanced the role of nursing by developing novel mathematical and implementation approaches for predictive analytics that led to a multi-center deployment of artificial intelligence systems during the COVID-19 pandemic.
Ingrid Pretzer-Aboff.
Imagine a world where people with Parkinson's disease can walk more freely and be more independent. My team and I at VCU have developed an innovative neurostimulator device to achieve these goals. I'm also fortunate to have been able to design and start a nurse-managed telehealth clinic that gave access to specialty care for people with Parkinson's disease, many for the first time in their lives.
From the state of Washington, Sarah Gimbel.
The development of the Systems Analysis and Improvement Approach, or SIA, and its subsequent implementation and expansion to prevent mother-to-child transmission of HIV is my contribution that has most impacted health. SIA is a model that harnesses the knowledge and creativity of frontline nurses and managers and promotes improved healthcare delivery through a nurse-led model of systems-oriented quality improvement.
Ira Kantrowitz-Gordon.
I am passionate about improving the care for childbearing families impacted by the opioid use epidemic. I am committed to using my research to better understand the stigma of perinatal opioid use disorder and to use this research to improve the care by nurses and midwives so that all childbearing families can thrive and have the best perinatal outcomes.
Connie Nguyen Truyong.
Through my significant anti-racism advocacy, community-based participatory research, policy changes on disaggregated data collection, and anti-racist cultural wealth curricula transforms immigrant and refugee healthcare and services delivery and reaching micronations and Native Hawaiian Pacific Islanders.
Renee Rossler-Bombers.
My contribution to healthcare and nursing includes community outreach and workforce development. I designed a mass vaccination model that was replicated and expanded to become the largest civilian-led vaccination site in the nation. I also led the team that designed and implemented the RN partner model to respond quickly to critical staffing needs resulting from the pandemic.
Kathleen Richardson.
My efforts focus on improving patient outcomes through policy, education, and informed clinical practice. Specifically, I focus on identifying gaps and developing programs and education to address those unmet needs.
Jennifer Sunny.
I lead research, graduate education, and advocacy efforts to expand access to high-quality pediatric care and improve pediatric health outcomes. As a child health advocate, I have shaped national pediatric research priority setting, revision of educational standards, and legislation impacting child health and APR in education.
Oleg Slosky.
I develop and test digital technologies to enhance the life of older adults by empowering them to promote their health, manage symptoms, and live well with multiple chronic conditions, while supporting their social connections with others.
From the state of West Virginia, Jennifer Malo.
For over a decade, the focus of my work has been the use of technology to improve access and outcomes in rural and underserved individuals. I have contributed to the science, practice, and policy of telehealth for those in Appalachia.
And from the state of Wisconsin, Michelle Polfus.
My research impacts health by addressing weight management in children who have developmental disabilities. The outcomes of my work that focuses on body composition, energy expenditure, and the role of the family will promote health equity and improve healthcare delivery for these children who are currently an underserved population that are at high risk for obesity.
This has been an incredible evening. We've had a lot of fun up here. I hope you've had fun out there too. I would like to thank all of the fellows, family, friends, and guests who joined us. Now, with 231 new fellows of the American Academy of Nursing, our progress toward achieving our vision of healthy lives for all people is one step closer. To each of our new fellows, welcome to the American Academy of Nursing, and congratulations. Now let's party.